Hello everyone.
Today, we'll be performing a role play between a nurse and a mother who is very concerned about her child's condition after being stung by a bee.
I'm Rosman. I will be taking the position of nurse.
I'm Neema. I will be performing the role of the mother.
Thank you for allowing me to assess your child's condition. From my examination, I came to know that your child is having the presence of bee sting and swelling. But try not to worry, we all are here to help you. So before proceeding further, may I ask you some questions about your child's condition?
Of course.
Does your child experience any other symptoms like itching, hives, nausea or breathlessness?
Yes, nurse. Actually, my child complains of pain and itching, but he has not vomited yet.
Okay, so I'm just recording all the information in your child's case note. All right, so what about home care remedies? Did you provide any other treatments at home like emollient creams or pain relief?
Nurse, actually, I was unaware of all those treatment and management methods, so I did not provide any such creams or anything. But nurse, actually, I gave him some paracetamol as he complained of pain.
No worries, Claire. So can you please tell me, does your child is having any other allergic reaction towards insect bite or any food, medications like that?
Nurse, actually, I do not remember any such incident.
No worries, Claire. Anyway, thank you for your valuable information. It helped me a lot to find out what exactly happened to your child. Right now, it's a time to explain what all are the likely treatments that we are going to give to your child. Firstly, we will provide antihistamines that will reduce swelling and other symptoms. Secondly, we will apply a soothing cream. Thirdly, a doctor will come and meet your child and a thorough examination will be conducted by the doctor.
Okay.
And we will thoroughly monitor your child condition. So are you on the same page, Claire?
Yes, nurse.
Is there anything else that I need to clarify with you, Claire?
Yes, nurse. Actually, I have a concern. I think that my son needs to stay in this hospital until his swelling goes down. He's very young too. Isn't that right?
I appreciate your question. Being a mother, I know how much you are concerned about your child's condition. So let me explain when the hospital admission is necessary. In case of allergic reaction and breathlessness, at that time only we will consider your child for hospital admission. But I can reassure you that he won't be discharged until the swelling goes down and we want to confirm there is no any other symptoms. So Claire, you can wait here and the doctor will come and see your child as soon as possible. So Claire, is there anything else that I need to address you?
No, nurse, it is very well clear.
So I hope I clarified all your doubts. If you have any doubts or queries, you can call me at any time or you can press this buzzer. So it's my pleasure to help you. So Neema, that was an interesting session, right?
Of course, it was. So I hope it was helpful for you, and a feedback session will be given very soon.
Hello and welcome to another feedback session where we are going to discuss on how to approach each and every task in a very effective manner. Now, this role play is happening in an emergency department where you are talking to a concerned parent of a 2-year-old boy who has come to the emergency department because he was stung by a bee a few hours ago. Now, you're seeing this parent and the child in triage, and you have just examined the child. Now, this is a very important information. Now, when you see that you have examined the child, it means that you have literally did the introduction and then you have did the examination, which means you don't have to start the role play with an introduction. So you have to either thank the parent for allowing you to examine the child or inform that you have completed doing the task. So let's do the first task by combining the start of the role play. Well, the first task is asking us to confirm the presence of bee sting and swelling. Now, there are other things you have to do in this task. That is, you have to find out about any other reaction to sting, and you have to also ask questions about the treatment whether the patient has given or the parent has given to the child back at home. So let's see how to do this task by starting the role play. So, I'm going to tell them that I have completed examining their son. So let's see. I have completed examining a child and I really appreciate your cooperation while I was examining him. Now, I want to tell you, in my examination, I could find obvious signs of bee sting and swelling. Now, before discussing about that further, I want to ask you a few questions. Will that be fine? Have you observed any other reaction to the sting? It can be itchiness, hives, fever, something like that. Once the parent has answered this, then we ask the another question. What about nausea, vomiting, and breathlessness? Have you observed such symptoms? In that case, I also want to know about the treatment you have given back at home. Have you tried applying any emollient cream? Or did you try giving any pain relief medication, something like that back at home? This is how you do the task 1. So the second task is asking us to explore history of allergic reaction. So to improve the effectiveness, you can put a sign posting and you can inform the parent that you have to ask one more question. So let's do this task. Okay. I want to ask you one more question. I want to know whether the child has any history to any other allergic reaction. It can be towards food, medicine, insect bites, or even stings. So have you observed any reaction happening to your child before this incident? This is how you do the second task. The third task is asking us to explain likely treatment. We should include explanation of antihistamines and its uses. Again, the task is asking us to outline next steps of the boy's treatment. So, we know that this task is happening after we have asked a couple of questions to the parent, and we should show our appreciation for that. So let's do this task. Thank you for answering all my questions clearly. I really appreciate it. Now, I want to explain you about the possible treatment we are going to give to your boy. So we might start antihistamine treatment. This is basically to fight the allergic reaction and reduce the swelling and make sure that there is no further symptoms related to it. I also want to explain you about the further management, what we're going to do to your son. First of all, I'll be applying a soothing cream and then the doctor is going to come and examine your child. And then your child will be kept here for monitoring for a few hours maybe. I know I've given you a lot of information here. Do you want me to repeat anything? Now, towards the end, I've told the patient that I've given a lot of information. It's very important, especially when you're giving a lot of information at the same time, just to make sure that your patient has understood everything. So let's move to the last and the final task. So this task is asking us to stress when hospital admission is necessary. We have to give reasons for that. And then we should reassure the parent that we won't discharge him until he's ready. And thirdly, we have to say that the doctor is going to come and see their son pretty soon. So, you know that this is a bit of a confusing task. And it's very important to put some sort of marking towards the side of this task and make sure that you listen carefully on what the parent has to say. So here the parent thinks that their son should stay long in the hospital, at least until the swelling goes down because he's so young. And that's why we're doing this particular task. So let's do it. I can see you're really worried about your son. But let me tell you, hospital admission will only be necessary if he's exhibiting serious symptoms like severe allergic reaction, breathlessness, for which he needs medical attention. Otherwise, it is better for him to go back home. And I can see you're really worried about your son. So let me assure you, we won't discharge your child until all his swelling has completely reduced and there's no other symptoms related to this allergic reaction. Will that be all right? Now, is there anything else you want to tell me? In that case, do you mind waiting here until the doctor comes and see your son? It is going to happen soon. Okay, so thank you. And if you have any other problems, please feel free to ring the buzzer. We'll be more than happy to help you. Thank you. So this is how you end the task. Dear students, I want to remind you once again that such task where you don't have to start your role play with an introduction is very common in your OET speaking test. Now, I hope today's role play and its feedback have been useful for you. With that, thank you.